To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, if you are suffering from back pain, today is for you because we are joined by Dr. Marjorie Delo from Delo Sports Medicine. Hi, doctor.
Good morning.
So many people are dealing with back pain. I want to get into that. So let's talk about those of us who are suffering from that constant chronic back pain. What are some factors of why I'm feeling that way?
Okay. The majority of back pain is what we call nonspecific. It's not one identifiable source like a ruptured disc or spinal stenosis. Most of the time, it's just across the low back and felt to be due to multiple structures just breaking down with time or not being strong enough. The discs are drying out, the ligaments are stretching out, there's an arthritic process beginning, and the muscles are spasming secondary to that and causing that pain.
It's not fun to get old. And so since we can't stop that, what are some treatments that you've seen successful to help ease that chronic back pain?
Okay, well, historically we know that working the muscles around the spine and making them stronger so they can stabilize that spine that's now micro unstable is step one. Regular aerobic exercise, we know, brings blood flow to the spine and will decrease pain. But a lot of people need something beyond that. What we're seeing really good results with is using prolotherapy, which is using growth factors to actually inject into those destabilizing structures and getting them to heal and tighten. And even better results when we start adding our regenerative medicine to that prolotherapy using your own cells, such as PRP or stem cells, to slow that degenerative process and heal the tissues that are causing pain.
What kind of case studies or results are you seeing from patients who you're treating this way?
So we're seeing two things. Some patients don't have nerve damage, but they have nerve involvement. And when we put that cellular mixture around a nerve, we're seeing really rapid improvement, which is great. Because we used to think that cortisone was our rescue drug, but now we have something else that's much safer that can calm that nerve pain. And then that chronic pain across the whole region is healing with time. So, you know, that's more of a 2 to 6 week, depending on the age of the patient, of course, improvement in symptoms, but just progressive improvement over time.
And the big key there is no surgery, completely safe, using your body. That's regenerative medicine, right?
Mm-hmm.
Yeah. Any last tips for maybe avoiding back pain?
Well, we know that core stabilization is something that, for whatever reason, recent generations are lacking, and we're seeing that be an increased risk for injury. So really getting into that Pilates or whatever core program works for you to try to stabilize that spine before it has the ability to break down.
How did I know, Doc? Asking a doctor, she would tell me to hit the gym, so I understand. Well, Dr. Delo, thanks so much for helping us out with our back pain, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.